A stroke is a brain attack. It is a sudden interruption in the blood supply to the brain, which can cause severe damage. It happens when blood flow to a part of the brain is cut off, either due to a blockage or a burst blood vessel. This is a serious medical emergency that requires immediate attention. Quick response can save lives and reduce long-term damage. Brain cells start to die within minutes of the stroke occurring. The longer the brain is deprived of blood, the more extensive the damage. Strokes are a leading cause of death and disability worldwide. They can leave survivors with significant physical and cognitive impairments. Understanding stroke and its types is crucial for prevention and timely treatment. There are two main types of strokes: ischemic and hemorrhagic. Every second counts when it comes to stroke. The faster the treatment, the better the outcome. The faster a stroke is diagnosed and treated, the better the chances of recovery. Immediate medical intervention can significantly improve survival rates. Knowing the signs of a stroke and acting quickly can make a life-saving difference. Common symptoms include sudden numbness, confusion, trouble speaking, and severe headache. The most common type of stroke is an ischemic stroke. This happens when a blood clot blocks an artery in the brain. The clot prevents blood and oxygen from reaching brain cells. These clots often form in areas where arteries have narrowed. This narrowing is usually due to a buildup of plaque. This buildup is called atherosclerosis. Ischemic strokes can cause lasting brain damage. This damage can lead to problems with speech, movement, and memory. A hemorrhagic stroke occurs when a blood vessel in the brain ruptures. This bleeding can happen in the brain tissue itself or in the space surrounding the brain. High blood pressure is a major risk factor for hemorrhagic stroke. It weakens blood vessels over time, making them prone to rupture. Other causes include aneurysms and arteriovenous malformations, or AVMs. Hemorrhagic strokes are less common than ischemic strokes but often more severe. They can cause sudden and intense headaches, often described as the worst headache of my life. Section 4. Be fast. Recognizing stroke symptoms quickly. In this section, we will delve into the importance of identifying stroke symptoms as early as possible. Time is of the essence when it comes to treating strokes, and knowing what to look for can save lives. Recognizing stroke symptoms quickly is crucial. The faster a stroke is identified, the better the chances of minimizing brain damage and improving recovery outcomes. Immediate medical attention can make a significant difference. The mnemonic "Be Fast" helps people remember the warning signs. It stands for balance, eyes, face, arms, speech, and time. Each letter represents a critical symptom to watch for. B. Balance, sudden loss of balance or coordination. If someone suddenly finds it difficult to stay steady or experiences dizziness, it could be a sign of a stroke. E. Eyes, sudden blurred vision, double vision, or loss of vision in one or both eyes. Vision problems can be an early indicator of a stroke and should not be ignored. F. Face, one side of the face drooping. Ask the person to smile. If one side of the face droops, it could be a sign of a stroke. A. Arms, weakness or numbness in one arm. Ask the person to raise both arms. If one arm drifts downward, it may indicate a stroke. S. Speech, slurred speech or difficulty speaking. If the person is unable to repeat a simple sentence correctly, it could be a stroke symptom. T. Time. Note the time symptoms start. Call 911 immediately. Every minute counts, so getting medical help as soon as possible is essential. Remember, Be Fast can help save lives. Section 5. Rapid Response, the key to stroke management. In this section, we will explore the critical steps and measures that need to be taken immediately when a stroke occurs. Understanding these steps can make a significant difference in the outcome for the patient. Time is crucial in stroke treatment. Every second counts, and the faster medical intervention is provided, the better the chances of minimizing long-term damage and improving recovery outcomes. The sooner treatment begins, the better the chances of recovery. Immediate action can significantly reduce the risk of severe disability or even death. Medical teams are trained to act swiftly and efficiently in these critical moments. Calling 911 immediately is essential. Quick communication with emergency services ensures that the patient receives the necessary care without delay. Operators can also provide vital instructions on what to do while waiting for help to arrive. For ischemic stroke, clot-busting medication may be given. This type of medication is designed to dissolve the clot that is blocking blood flow to the brain, which is a common cause of ischemic strokes. This medication helps dissolve the clot and restore blood flow to the brain. Restoring blood flow quickly is crucial to prevent brain cells from dying and to improve the patient's chances of a full recovery. It's most effective when given within a few hours of symptom onset. The window for administering clot-busting medication is narrow, typically within 3 to 4.5 hours from the first signs of a stroke. Hemorrhagic stroke treatment often involves surgery. This type of stroke, caused by bleeding in the brain, requires different interventions compared to ischemic strokes. Surgery can help control bleeding and reduce pressure on the brain. Surgeons may need to repair blood vessels or remove blood that is pooled in the brain to alleviate pressure and prevent further damage. Medications may also be used to lower blood pressure and prevent further bleeding. Managing blood pressure is crucial in both types of strokes to stabilize the patient and prevent additional complications. Section 6. Stroke, a race against time. Stroke is a serious medical condition that requires immediate attention. Knowing the signs of stroke and acting quickly can save lives. Remember, be fast and call 911 immediately if you suspect a stroke. Time lost is brain lost. By understanding stroke and taking swift action, we can improve outcomes and reduce the burden of this devastating condition.